You've spent years making healthier choices, adding more veggies, cutting back on processed foods. But what if some of the foods you trust are quietly working against your health? After 60, your body changes, and so do your dietary needs. Foods that once helped might now cause discomfort, worsen joint pain, or even clash with medications. Don't worry, this isn't about cutting everything out. It's about getting smarter with what's on your plate. In this video, we'll uncover 8 everyday foods that could be doing more harm than good, and what to eat instead. Welcome to PulseWise, where your health is our heartbeat. As we age, what we eat matters more than ever. Some vegetables and healthy foods may actually worsen common conditions like arthritis, acid reflux, or kidney issues. Today, we'll explore 8 surprising foods that older adults should reconsider and offer better, safer alternatives. This isn't about fear, it's about informed choices. Whether you're managing medications, digestion, or chronic pain, the right food swaps can make all the difference. So grab a cup of tea, settle in, and let's take a thoughtful look at what's really on your plate. Before we dive in, make sure to hit that subscribe button and turn on notifications so you never miss out on simple, science-backed tips to stay healthy and feel your best. Let's start with a leafy green packed with vitamins, but needing careful consumption by seniors. Chard. Chard is a leafy green powerhouse, full of vitamins A, C, K, and minerals like potassium and magnesium. It's great for bone and heart health. But for seniors, chard comes with some important considerations. Like beets and okra, chard is high in oxalates, which can increase the risk of kidney stones in people prone to them. Chard also contains a lot of vitamin K, essential for blood clotting, but potentially problematic if you're taking blood-thinning medications. Cooking chard can reduce oxalate levels and make it easier to digest. If you enjoy leafy greens, just be sure to balance your intake and discuss any medication concerns with your healthcare provider. Now, let's talk about Brussels sprouts, small, nutrient-packed veggies famous for their fiber and cancer-fighting properties. But if you're over 60, these little green gems can sometimes cause digestive troubles. Brussels sprouts are high in fiber and sulfur compounds. While fiber supports digestion, too much at once can be tough on an aging digestive system, leading to gas, bloating, or even constipation, especially if you already have irritable bowel syndrome, IBS, or slower digestion. The sulfur in Brussels sprouts also causes that distinctive smell when cooked and can stimulate excess gas production, making some seniors uncomfortable. The good news? Cooking thoroughly, whether steaming, roasting, or boiling, breaks down some of the fiber and sulfur, making them easier to digest. Start with small servings and pair Brussels sprouts with gentler foods, like rice or cooked carrots, to help your stomach adjust. If you find them too harsh, softer veggies like zucchini or cooked green beans can provide similar nutrients with less digestive upset. Up next, we'll look at a popular and versatile veggie, tomatoes, and what seniors should keep in mind when enjoying them. Tomatoes are a staple in kitchens worldwide, loved for their bright flavor and versatility. They're packed with lycopene, an antioxidant linked to heart health and cancer prevention. But for seniors, tomatoes can sometimes cause digestive or inflammatory issues. Tomatoes are part of the nightshade family, like bell peppers, and may trigger inflammation in some people with arthritis or sensitive joints. They are also acidic, and when cooked, like in sauces or soups, the acidity can increase, potentially worsening acid reflux or heartburn. If tomatoes cause discomfort, consider switching to lower acid varieties, such as yellow or orange tomatoes, or limit consumption of highly concentrated forms like tomato paste. Pairing tomatoes with non-acidic foods can also help reduce digestive upset. Let's move on to okra, a beloved vegetable in Southern and Creole cooking. Known for its unique texture and thickening properties, okra adds richness to soups and stews. But for many seniors, it can cause some digestive discomfort. Okra contains fructans, a type of carbohydrate that can be hard to digest for some people, especially as our digestive system slows down with age. This may lead to bloating, gas, and stomach upset. Additionally, okra's mucilaginous, or slimy, texture isn't appealing to everyone and can be tricky for seniors who have chewing or swallowing difficulties. Okra is also high in oxalates, which, as we've mentioned before, may contribute to kidney stone formation in those at risk. If you love okra, try cooking it well. Roasting or boiling can help reduce its effects. Eating smaller portions and drinking plenty of water can also ease digestion. If okra doesn't agree with you, consider substituting with gentler veggies like green beans or zucchini, which offer similar fiber but are easier on the stomach. Coming up, we'll talk about a common kitchen staple, garlic, and why moderation is key for seniors. Garlic is often called a superfood, and for good reason. It's known to support heart health, boost immunity, and even lower blood pressure. But for seniors, garlic can sometimes cause unwanted side effects, especially when eaten raw or in large amounts. One concern is garlic's blood-thinning effect. If you're on blood thinners like warfarin or other medications, eating lots of garlic could increase your risk of bleeding. Garlic can also irritate the stomach lining, leading to acid reflux, heartburn, or upset stomach, particularly for those with sensitive digestive systems. Cooking garlic reduces its harshness and makes it gentler on your stomach, allowing you to still enjoy many of its health benefits. If you're taking blood-thinning medications or often experience digestive discomfort, it's a good idea to check with your healthcare provider before increasing your garlic intake. Next, we'll explore a crisp vegetable that adds zing to salads, but might be too harsh for some seniors. Radishes. Radishes add a refreshing crunch and a little spicy kick to salads and dishes. They're low in calories and provide some vitamins and antioxidants. But for seniors, radishes can sometimes be hard on the stomach. Radishes contain compounds that may irritate the stomach lining, causing bloating, gas, or discomfort, especially for those with sensitive digestion or conditions like irritable bowel syndrome, IBS. They also have mild diuretic effects, meaning they can increase urine production. This might affect fluid balance, especially in seniors with kidney problems or those on diuretic medications. Cooking radishes can soften their flavor and make them easier to digest. If radishes cause digestive issues, softer veggies like cucumbers can offer a similar crunch without the irritation. Coming up next, we'll take a closer look at another surprising veggie that might be spiking your blood sugar, and it's often found in salads and juices. Next up are beets, those vibrant, ruby red root vegetables loved for their earthy flavor and impressive nutrients. They're rich in antioxidants and known to support blood flow and lower blood pressure. But for seniors, beets come with a couple of important caution flags. Beets naturally contain quite a bit of sugar. For many older adults managing diabetes or insulin resistance, this means eating too many beets could cause blood sugar levels to spike. That doesn't mean you have to avoid them completely. Just be mindful of portions and frequency. Another consideration is oxalates, naturally occurring compounds in beets that, in high amounts, can contribute to kidney stone formation. If you have a history of kidney stones or kidney issues, it's worth discussing beet intake with your healthcare provider. If you love beets and want to keep them on your plate, try cooking methods like roasting or steaming, which can lower their glycemic impact. Another tip is to dilute beet juice with water or blend beets with other low-sugar veggies in a salad or smoothie. By taking these small steps, you can enjoy the benefits of beets while minimizing the risks to your blood sugar and kidneys. Our final vegetable today is a colorful favorite, bell peppers. Crunchy, sweet, and packed with vitamin C, they seem like a perfect addition to any healthy meal. But for many older adults, bell peppers can bring unexpected problems, especially when eaten raw. Why? It starts with digestion. Raw bell peppers can relax the lower esophageal sphincter, a small muscle that keeps stomach acid from rising. When that muscle loosens, acid reflux or heartburn can follow. If you already deal with GERD or indigestion, this can make symptoms worse. But there's more. Bell peppers are part of the nightshade family, a group of vegetables that includes tomatoes, eggplants, and white potatoes. These contain compounds called alkaloids, which may trigger inflammation in sensitive individuals. If you live with arthritis or joint pain, nightshades like bell peppers might quietly be making things worse. So, does this mean you have to stop eating them? Not necessarily. It's all about preparation and moderation. Cooking bell peppers, by roasting, sautéing, or steaming, can reduce their acidity and make them easier to digest. Pairing them with gentle, non-acidic foods can also help. Still feeling discomfort? You might try swapping them out entirely. Zucchini, for example, has a similar texture when cooked but is gentler on the stomach. Or consider carrots, which brings sweetness and crunch without the reflux risk. If you're on medication for acid reflux or taking anti-inflammatory drugs, check with your doctor about how certain veggies may be affecting your symptoms. Food sensitivities can evolve with age, so even familiar favorites deserve a second look. Remember, your goal isn't restriction, it's alignment. Align your meals with your body's changing needs, and you'll feel better with every bite. Now that we've covered these veggies, let's wrap up with some tips to keep your diet both healthy and comfortable as you age. Eating a variety of vegetables is key to a healthy diet, especially as we age. But it's important to know that some veggies might affect seniors differently, whether by causing digestive discomfort, interacting with medications, or influencing chronic conditions. By understanding which vegetables to enjoy in moderation, how to prepare them, and when to seek alternatives, you can keep your meals both nutritious and gentle on your body. Remember, everybody is unique. Always listen to how your body responds and consult your healthcare provider with any concerns. If you found this guide helpful, please like, subscribe, and share it with friends and family who want to stay healthy and vibrant. Thanks for watching PulseWise, where your health and wellness always come first. See you next time.